Welcome. This presentation outlines a culturally tailored intervention to address obesity-related non-alcoholic fatty liver disease, also known as fatty liver, in Salinas, California, a city with a predominantly Hispanic population and a unique cultural history. We begin by discussing Salinas' demographics and the specific health disparities affecting this community, including the rise in obesity and the fatty liver. Next, we evaluate the readiness of the Monterey County Department of Health. Salinas is located in the Monterey County, which is in the central coastal California, to support this intervention, emphasizing their experience with community outreach and culturally tailored health programs. From there, we explore the problem statement and literature review, highlighting the role of cultural perceptions, dietary shifts, and health literacy in contributing to the fatty liver. The framework and change model guiding this project are presented next, followed by the implementation and evaluation plans. Finally, we will discuss disseminating strategies and sustainability efforts, ensuring that the intervention fosters long-term community health improvement through collaboration and ongoing education. Salinas is a city with deep historical and cultural roots. Known as the hometown of Nobel laureate John Steinbeck, it served as the backdrop for many of his iconic stories. Today, Salinas stands out with its vibrant Hispanic community, which comprises almost 80% of its population, the highest in America, in California, and the eighth largest in America. This unique demographic makes Salinas an ideal location for our intervention. By addressing obesity and the fatty liver in this community, we have the opportunity to make a meaningful impact on the population that reflects the broader challenges facing Hispanic Americans across our nation. Our PICO question focuses on improving health literacy and promoting healthier dietary practices through culturally relevant strategies, bridging gaps that persist in health outcomes. Ironically, Salinas is also known as the salad bowl of California, since it grows cabbage and lettuce predominantly as the main agricultural product. Our PICO question is as follows. Among Hispanic adults in Salinas, California, how does a culturally tailored dietary intervention compared to standard dietary advice affect awareness of fatty liver and healthy dietary practices over 3 months? Non-alcoholic fatty liver disease is on the rise among the Hispanic population, with Mexican Americans being particularly vulnerable. This increase is closely linked to obesity, a condition disproportionately affecting this group due to cultural, socioeconomic, and health literacy barriers. Many individuals do not understand the connection between obesity and fatty liver, leading to a lack of preventive action. As the fatty liver progresses, the progression is fibrosis to cirrhosis. It can result in severe complications with significant health risks. Eventually, these people will need a liver transplant or they die. Despite these challenges, existing health interventions often fail to address unique cultural and dietary needs of this population. Research shows that Hispanic populations, especially Mexican Americans, are hit hardest by obesity-related non-alcoholic fatty liver disease. Shaheen and colleagues found that Mexican Americans experience higher rates of hepatic steatosis, which is a fancy way of saying fatty liver, than other Hispanic groups, largely due to obesity and changing dietary patterns. A big part of the problem is cultural. As Morrill et al. Pointed out in his 2021 publication, many people in this community don't see themselves as obese, even when clinical markers say otherwise. In their culture, a larger body size is often viewed as a sign of health and prosperity, which is very different from how medical professionals define obesity. Aliman emphasized the importance of culturally sensitive approaches to tackling these perceptions. Diet is another key factor. For example, Fargus's paper noted that the traditional Mexican diet, which is full of nutrient-rich, balanced meals, has been replaced with an Americanized version, which is loaded with processed foods high in sugar, fat, and sodium. This shift has significantly contributed to rising obesity and fatty liver rates. Case and Wilkerson also highlighted how financial and cultural barriers make it harder for low-income families to access healthier foods, which is ironic since Salinas grows primarily lettuce. To make a real difference, interventions need to bring back traditional, healthier dietary practices while addressing these economic and cultural challenges. When we align health strategies with the community's cultural values and habits, we can create interventions that are both impactful and sustainable. In this slide, we're going to talk about the framework and the change model that we're going to use. For this intervention, we adopted the community readiness model and the McKinsey 7S framework to guide implementation and ensure its alignment with both community and organizational needs. The CRM model was chosen because it evaluates a community's preparedness to address specific health issues, which is, in this case, is the obesity. Using this model, we assess Salinas as being in the pre-planning stage out of 9. So it's closer, so 1 being the most unprepared, no awareness, to 9 being fully aware. Pre-planning is at 4, so there's a lot of work to do. There's some awareness of health issues, but limited structural action. This helped identify key gaps such as the need for culturally relevant education and greater leadership involvement. The McKinsey 7A as framework provided a comprehensive organizational approach to align strategy, structure, systems, shared values, styles, staff, and skills within the interventional goals. Together, these models create a robust foundation for implementing meaningful change tailored to the unique needs of this population. Let's talk about organizational culture for a couple of minutes here. Organizational readiness refers to the organization's ability and willingness to execute new initiatives effectively, factoring in resources, staff engagement, leadership support, and alignment with its mission. In our case, the organizations are the people themselves, the residents, and also the systems such as the Department of Health and the healthcare systems. Given the high prevalence of fatty disease in Salinas' Hispanic community and the cultural and socioeconomic barriers highlighted in the literature, the Monterey County Department of Health and health systems have a unique opportunity to lead this effort. Their focus on health disparities, established community outreach programs, and infrastructure for culturally tailored health services indicates strong readiness to support this intervention. The intervention's cultural relevance further enhances this readiness. By addressing health literacy gaps and promoting dietary practices rooted in traditional Mexican cuisine, it aligns with the community's values and traditions. So how do we actually implement it? So let's talk about the implementation plan. This intervention will focus on tailored strategies. The plan is structured into 4 phases: preparation, intervention, data collection, and evaluation. During the preparation phase, bilingual health educators and community health workers will be recruited and trained to deliver culturally relevant dietary education. So the translators, they have to be native residents and the native speakers in order to translate the nuances. Some of the people there, they speak Spanglish, really. It's a combination of English and Spanish. So there is a lot of work needs to be done to convey the dietary education. The intervention phase involves hosting health fairs and workshops. So one of the main fairs that this implementation plan will be delivered at is in the Wellness Center, Wellness Health, that's sponsored by the Department of Health. So educational materials, including flyers and posters, will be distributed in both English and Spanish. Data collection will rely on semi-structured surveys and observations to assess changes in participants' health, literacy, and dietary behaviors and engagement. So how do we know that our implementation worked? So we're going to evaluate it. Our evaluation plan includes mixed method approach for data analysis, incorporating both quantitative and qualitative methods to provide a comprehensive understanding of its impact. For the quantitative component, a single t-test is used to analyze pre- and post-intervention survey results. This test is appropriate given the open nature of data collection where participants may differ between the two phases. The t-test evaluates whether the intervention has led to statistically significant improvements in health literacy, dietary behaviors, and knowledge of the link between obesity and the fatty liver. For the qualitative component, thematic analysis is employed to identify patterns and insights from open-ended survey responses and participant feedback. So dissemination is actually extremely important since we're going to not just focus on one thing at the fair, we're going to spread the word. We're going to tell people about some of the interventions that are helpful to them. People don't really know. That is the whole point of this project, is to disseminate knowledge. So the success really depends on the strategies of dissemination, how to reach the stakeholders and the broader community. So social media is an excellent platform for this. Most people kind of watch TikTok, Facebook, Instagram. There are a lot of options, videos, and the short attention span. So I think TikTok would be an ideal, or YouTube Shorts medium for this kind of thing in both English and Spanish, because you can actually do subtitles. Local radio and TV campaigns in Spanish will further extend outreach, although podcasting is also a huge popular medium that people listen to. Whatever works. In-person engagement will remain a cornerstone of dissemination. So I talk to my coworkers, I talk to my patients. I really would like for them to, and they do ask questions. I think there is a lot of interest in this topic. So by just talking to them, it kind of creates a ripple effect. They will go home and they will share that with their family members. So that's another excellent way to disseminate the knowledge. So the long-term sustainability of this, the success really depends on, now we're going to talk about the Monterey's Department of Health. I really need their engagement. Their website, if you actually go on their website and you click on the services that they offer and the diseases that they focus on, you will not find obesity anywhere near, which is, I find ironic, since diabetes is a huge problem in the town as well. So there is nothing on obesity. There's nothing on obesity prevention. So it kind of suggests that these issues are not viewed as a priority. So the biggest thing would be to reach out to the department and actually ask them to put that in there. People do click on official websites. So there are going to be a lot of resources. I do need the county's resources to work with me on this. And I think reaching out to them would be one of the biggest challenges, since it is a government institution and they have their own priorities. So just to wrap this all up, in conclusion, this project aims to address the rising rates of obesity and obesity-related fatty liver disease in the Hispanic community of Salinas by employing culturally tailored interventions that promote health literacy and traditional dietary practices. This project seeks to bridge gaps in understanding and improve health outcomes. Guided by the community readiness model and the McKinsey 7S framework, the intervention aligns with both community organizational needs. Implementation strategies include health fairs, supermarket outreach, and bilingual educational resources, with evaluation supported by mixed method analysis. Sustainability relies on advocacy for departmental prioritization, community partnerships, and consistent refinement based on participant feedback. This comprehensive plan not only empowers individuals with knowledge and resources, but also sets a foundation for long-term community health improvement. Thank you.